All right, I hope this comes in clear. I want to make a video today because, hey everybody, welcome back to the channel, and I want to make a video that's just a little longer than my shorts. So I hope maybe done less than 3 minutes. And it goes something like this. A while back, I responded to a post on Facebook where somebody had posted that they were getting an injection in their back, and it looked like something that's called a rhizotomy in the medical field, also known maybe as a nerve block, or they're going to do something to like a particular nerve root where they block the signal so that it won't communicate pain. So I asked the person, I said, hey, friend, what procedure are you getting done? I'm curious. And he goes, the one and done kind, doc, because he's thinking, I'm going to tell him to go to a chiropractor. Who knows? At that time, I might have been like, oh, go see the chiropractor. There's still times that I get super fired up. I'm like, you got to go see one. The thing is it obviously did not take away his pain permanently. It did not, the one and done. It's very rare that actually happens where there's some kind of pain that then, one and done fixes it. And that's really kind of the underlining message of this video is, please, I hope all of you out there realize that, say you have a mechanism of injury, meaning like you did a deadlift, you landed from grabbing a rebound, you pulled a box heavy from the attic, whatever, the basement, and you hurt your back, and you've ever since then had a pain. Maybe an old football injury that ever since then you've had these back spasms, or your back feels like it's always going out, or whatever the case may be. There's really no one and done to fix this kind of thing, especially when you go to the MRI. Let's say you get an MRI and there's no disc herniation filling up a big space in your spinal column, pressing on a nerve root, or impinging on the spine, on part of the spinal cord, something called either like a foraminal or a central stenosis. When those things don't exist and they're not like literally in there, where I'm not going to use more medical terms now to like sound smart. I'm just not going to do that right now. Okay. So in order for those, these physical bits of matter from our spinal column that could potentially be impinging and causing so much discomfort, pain, and more importantly, dysfunction, motor or sensory loss, from the actual muscle based on the nerve root or your extremity, as it's called, like our leg, our foot, our knee, right? Again, mostly lower back pain. Usually a surgery in that case that may be warranted would be not even a one and done, but it would be very helpful. And then you would begin physical therapy, rehab, and you would be, in a lot of pain for about 6 months while the muscle and the tissue recovered. And then even then, again, the physical therapy to kind of stretch out the tissue that had been compressed from stitching things back up. You see where I'm going with this. So there's really no such thing as a one and done, especially if you're not getting a surgery to actually correct again that matter that's filling a space and taking away the ability for you to have a range of motion. Which is interesting, because if people go to a chiropractor and they get adjusted and they're like, I feel a little better, or it feels like a little bit of soreness there but nothing like before, these are really good signs, folks. Okay, that's the take home for chiropractic is that's a really good sign, is because we didn't injure you, chiropractic didn't injure you. Chiropractic is not responsible for giving you a one and done, or it didn't work because my pain didn't go away. It's a process, but more importantly than a process, because that may be a misnomer, it is an element, it is a component of your care, sometimes the greatest component, to reduce the pain so you can have greater range of motion and the ability to recover on your own through the active therapy. Chiropractic does the passive therapy, the nice, hopefully good thudding, cracking, satisfying feeling, the cathartic feeling you get of relief and tension release, and muscle spasms reduce, the splinting and holding together, cramping down on that area that is protecting because of the inflammation cascade, that is telling that joint or that muscle in that area that's building scar tissue and adhesions around it, yes, it's true, I'm sorry, it's protecting, okay? When that finally releases, there's obviously going to be residual pain. This is deformed tissue. This is tissue that has ligament damage, most likely disc damage at that joint in the spine, is from C2 down to the S1. I mean, there's disc damage potential, ligament damage, tendinous damage, which then has the musculoskeletal type, the muscle damage, the muscle fibers, the fascial distortion, the fascia that runs all the way up and down. That's why everything's connected. We talk about everything being connected. We're talking about fascia. We're talking about from the neck all the way down to the tailbone, that fascial distortion, one side compressed, one side stretched. I talk a lot about that in my clinic. Your hopes, not even goals, but your hopes as a patient when seeking a chiropractor or a therapist to do manipulative therapy or to work with you to bring back balance from a muscle imbalance. Another thing, I don't know, I hear people talking about muscle imbalance as if it's got tons of validity behind muscle imbalance. We can just call them inappropriate neuronal patterns. We can call it misfiring. We can call it a bad signal from brain to body, nervous system. We can say that. Well, we'll just call it a subluxation. Why? Forget bone out of place. We're just going to say pressure on a nerve. We're going to say irritation or interference in the nervous system based on that joint being less than optimal. Less than optimal. Luxation, maybe a bit of a misnomer. But again, to hammer it home, your hopes as a patient out there, my hopes as a patient, is to always find the chiropractor that can sort of understand the science behind it, understand the biomechanics behind it, and then give a good enough adjustment to be able to make a big enough difference, whether it's 1 time, 3 times, 6 times, no times, to get a big, a noticeable change. So that's your goal. That's my goal as a provider, to give that. And the last thing I want to say is, again, when it comes to managing pain, I want you to think about this. I saw a young lady, I'm going to actually use your name here, Morgan. I hope that's okay, and I hope you see this video. She came to me, over a year ago. I work with her, with almost her whole family, her mom, her husband, and came to me and said, I've been having this back pain, and then we would adjust her and she'd feel better, and I wouldn't see her for months, and then she'd come in and say, little tweak in the back, little tweak in the neck, adjust her, she'd feel better for months. And finally, she did something the other day doing a deadlift, and she was in pretty rough shape. So she came into me, and you could tell she was struggling. She was actually scared to bend forward. And this is a person that has unbelievable amounts of range of motion. She can do full splits. She can do handstands with the legs going like this and like this. I mean, unbelievable mobility. Some people might listen to this, so she's hypermobile. I don't know. Let's just put it this way. She's strong. She's fit. She has great form when she lifts. I have nothing but the utmost respect for her. She's knowledgeable. She's fantastic. But she had been training so hard, fatiguing her muscles so much, to which she reached the point that deformation of the tissue set in. She did a little bit, how should we say, a little bit more of like a free range of motion, a little careless in the bending and turning, right? Bending, reaching, turning. And that is the component that tweaked her disc fibers, the ligaments, the tendon, hurt her back. So she came into me and I noticed how hurt she was. And I said, give me 3. Whenever people come to me with the disc, it's usually give me 3 or give me 4. I say, give me 3 adjustments. The first day made a big difference. She was still obviously in some pain. She woke up wanting to take some pills and stuff. She said, oh, should I take this? Can I take that? I said, no, just come in, trust me. And then the second day was like just huge, super impactful adjustment. We had broken through that first initial barrier of inflammation. On the first day, the second day was beautiful. You could even warrant that she didn't even need the 3rd adjustment. But in my experience, I think the 3rd adjustment, which my combination was, the actual prone extension, sort of thoracic lumbar area we started with. Then we moved on the same day, a light side posture adjustment, just a little bit of motion. The following day, she came in and we adjusted L5 very, very thoroughly, along with another thoracic segment very thoroughly. And it was the desired outcome. Big physiologic change. The next morning she had come in. She actually came in a little later because she picked up a shift and went back and did some of her working out and taught some of her classes. And she came in later that day and we did a very light lumbopelvic, so pelvic, SI joint specific adjustment. And I think one other adjustment for the cervical spine. And, I deem her, good to go for as many months as she needs. We obviously talked a lot about exercise because exercise is the component that builds stability around the joints. I'm telling you all this full circle to say, the intervention to chiropractic to reduce, eliminate, or get pain or bring stability to a joint is so intricate. It's like so nuanced from person to person. And you want your chiropractor thinking about these things, not because I am thinking about them, but because it's so important to see full spectrum, full picture, understand how individualized the care is, and then to wrap it all up, monitoring this pain, mediating / managing it too as a provider and as the person who's suffering with it is kind of a full-time job, whether it's small pain or big pain. Because a lot of people credit, oh, I do yoga all the time for this, I do meditation all the time for that, I do working out all the time for this. All the different things that people do is that medicine, that's that full-time job to end up staying pain-free. Because there is no such thing as a one and done. All right, guys, I'm done. I got to get to work. Till next time, it's Dr. Pearlman.